Okay, so I have a lot to cover. You know, I know some of you who have seen an NAHU president in the past talk a lot about legislative, regulatory, and what's happening at NAHU, and what are our goals and objectives. But since March 23rd, 2010, I've talked your ears off, our members' ears off, as it relates to healthcare reform. And I know you know what it's all about. If you want to ask me anything about healthcare reform, go ahead, shoot. I'm a broker just like many of you are. I live it, I eat it, I breathe it, I sleep about it every single day. So I know just as much about it as Janet Frontline and Jessica Waltman, although they will claim that they know a lot more than me. But I'm on the front line just like all of you. So my decision over the past few months in my travels across the country, and I have about 50 trips that I do, is I want to talk about striving for success. How to navigate the complicated industry that we're in today, try to use the healthcare reform to allow ourselves to be more successful, what types of investments I'm making in my own business. So let me at least take you back first before I get into the presentation. So I am a broker, just like you, many of you. I know that when we were talking earlier, you said, Tom, you're in Washington, D.C. I said, well, I'm actually not. My home is in southern New Hampshire. I'm 30 miles from the shortest seacoast in the entire 50 states that we have. We have 3 beaches, Hampton, Seabrook, and Rye. That's all we have. It's 3 small towns along the seacoast, but it's a beautiful area to live. I do spend maybe 1 or 2 days a month in Washington, going down to talk to staff and doing planning and organizing and strategizing over what we need to do the next month to make a difference in the lives of our members. But I am a broker. I started the insurance business in 1989. Like many of you who came to this business in the 70s and 80s, I started just like you. I came from the life insurance business. I worked for Prudential. Started the year 1989. I had nothing. I had no experience. I just had a phone book. That's what we had. And every Monday I went to the Registry of Deeds to look up who just purchased a house because we had this thing called mortgage protection. Okay? Mortgage protection was when we purchased life insurance to cover the cost of the home. So I started like many of you. And then in 1995, I talked to my wife and I said, you know, we can't be selling life insurance for the rest of my life because it requires me to be working 12 hours a day. And now that we have children, we need to start planning. We need to start getting me out of the life insurance business. Nothing wrong with life insurance, but I needed to have an 8-to-5 job. So then I started to get into the employee benefits arena. In 1997, I started my new company, Landmark Benefits, with nothing. But at that time, I had 3 children. I had a 3-year-old, a 1-year-old, and an infant. And I had nothing. I had recurring revenue at that time, about $3,000 to $4,000 a month. That's all I had. No staff, a small office, 10 by 10, cardboard boxes for my file cabinets. And today, fast forward to 2013, I have one of the largest employee benefit practices in all of New England. It is a thriving practice. There's only one salesperson who works there, and that happens to be me. And as you learn about me, I'm not about glitz and glamour and fancy sales techniques. I'm about being honest, being responsive, exceeding expectations, delivering every single day, and making sure that I'm responsive. So that's a lot of what I do. It's more about my values. But what I wanted to do for you today was bring you into my office, because I know this. If any one of you who are brokers in this room, and you want to talk to one of your competitors who's in this room, and I know you like that person, I know you get along with them, they may be part of your second family, but you're not going to give them your trade secrets. Fair statement? Well, none of you are going to New Hampshire the next few months to take away my clients, right? So quite frankly, I don't care. Okay? So whatever question that you have for me today, go ahead and ask. Ask me how I deliver my wellness programs. Ask me about my compliance that we deliver to our clients. Ask me how it was that we sold 1,000 life group just a few months ago. Ask me what the differentiation is. I don't care. Anything you want to ask me, go ahead, because what I want more than anything else from today is you walk away saying, that was the most worthwhile seminar that I have been to in my lifetime. Okay? And if you ask that question, it will be. I promise you. So we're going to cover a lot. First of all, I'm going to talk to you a little bit about healthcare reform and how it's actually improved my practice, not taken away from my practice. I will share with you that I just closed my books on the plane yesterday down here. And although I was NAHU President for 6 months of last year, although we've dealt with healthcare reform, although we've dealt with DOL audits and other complicated aspects of what my practice has, my business grew by 27% last year. 27%. That's huge, right? That's fair statement, that's huge. A lot of that has to do with what I'm going to share with you today. These secrets that I have are not really secrets. It's about getting it done. It's about planning and organizing. One of the things I've learned early in Prudential is people who have failed didn't fail to plan. They failed to plan. They failed to plan. They didn't plan to fail. You get that? I blame the medication that was coming off right now. Is that okay? I told my good friend Bart Camerata back here from Benefit Advisor TV that You know, when you get off these drugs, it just takes a little while to get your clarity back. So if I mess up a couple times, give me a little breathing room. Okay, I'm going to talk about employers, I'm going to talk about members, how to differentiate yourself in the marketplace. I'm going to bring you into my office. I'm going to introduce you to my entire staff, what they do every single day. It may surprise you that with 27% growth last year with no other salespeople other than myself, but what does everybody else do? They're all there to support the clients. We deliver based upon service. That's what we do, 100%. I never make a phone call. I don't market. I don't advertise. They find me, 100%. So then we're going to talk about NAHU a little bit, because I want you to know how hard we're working on your behalf and that your membership dollars, your investments that you make in NAHU are very much worthwhile. I'm going to talk about some of my goals over the past 6 months and the next 6 months as it relates to NAHU, a decision matrix, and the top reasons that I believe you should belong to NAHU. And I do have an offer for you today, because first of all, you're going to have a presentation here, which is on my thumb drive, but I'm going to email it to everyone who sends me an email. All you need to do is send me an email with a screenshot from the NAHU page that you're a member of NAHU. Okay? Screenshot, you hit Alt, print screen. That's all you need to do to get the screenshot of your NAHU membership. That's all I'm asking you to do. Send me that email, and I will send you this presentation. I will send you my healthcare reform presentation, and I can't tell you how much business we have sold simply from our healthcare reform presentation. We've sold a lot. Okay? I'm going to send you all of my model notices that I have in my system, exchange notices, COBRA notices, 14-day, everything that we're talking about today as far as notices, and every notice I have in my office, you will have it. In addition to that, thank you so much, Justin. In addition to that, I'm also going to send you my compliance checklist. A lot of what my practice says today is all about compliance. We have really transformed ourselves over the past 10 years that we're really not, we don't have that perception of just being an employee benefits broker. We are the consultant. We are a partner. We're just as much as the CPA, the attorney, and then my company. We are in that same mix as far as we're concerned. So the compliance checklist that we have, make sure that your clients are compliant with DOL, IRS, and other issues that they're supposed to be focusing in on every single day. In addition, if anybody's not a member today, I brought with me 5 applications for membership and a little bonus, a $50 gift card for 5 people who prove that they become a member today, and this is yours. This is my gift to you, okay? That's a fair deal, right? No NAHU president has ever done that as far as I'm concerned. Is that true, Jeff? I don't know. Never saw it before. Never. So first of all, my healthcare reform presentation, because I have a couple of staff members who primarily deal with communications and marketing internally, they make up these beautiful presentations about healthcare reform, and we cover everything. We talk about all the provisions that are already in effect, what's coming, what's going, what's changing, how are employers being affected, how are employees being affected, how to do the payer-play calculations. Let's talk about the employee notices. Let's talk about PCORI. We love PCORI, right? You know what PCORI is, everybody? Okay. Current events in Washington, taxes and fees. It is extremely comprehensive. The presentation is about 3 hours long, but it can be as long as you really want it to be. The first thing that we typically do is do a 1-hour teaser course for employers, and then they come back for a full comprehensive 3-hour course to make sure that they can understand how healthcare reform is affecting their business. Some of you may be in the individual markets as well. A lot of this presentation also deals with primarily the individual market. Circling back a little bit about my practice, because remember I said I started in 1997. Well, my growth couldn't have happened if I hadn't made specific and deliberate changes in my practice as it relates to some of the things that we've already talked about today, compliance and wellness and things like that. But also, when I first started, I was talking to Justin earlier, and he said some of the people who are in the audience today, and possibly some of the folks who are going to be watching this video, have predominantly been in the small group business for years. Well, I want to tell you, when I first started my business in 97, that's what I did. That's all I did was small group. I did 1 to 20 lives in that ballpark. And it was predominantly because I didn't really have the confidence in myself that I should really be talking to employers that have 20 or more employees. But then there came a time, probably somewhere around 1999, 2000, where I said, you know, there's really not much of a difference between an employer of 19 versus an employer of 40. So I said, well, let's go ahead and let's make the leap. Let's make this gargantuan leap from the small group market into the, and for New Hampshire, the middle market, to start providing services to clients who have 40 employees. And then once I had the confidence in that over a couple of years, I said, well, what reason is there that I can't sell someone who has 50 lives? So there I am, a guy who's very shy, as you can see. I took this opportunity to jump into this larger marketplace, but now the sky's the limit as far as I'm concerned. The fact is, if you're doing small group today, you can easily do a group of 100, 200, 500, 1,000. I am a living testimonial to that because my practice, we provide services to all size companies. It makes no difference. The fact is, don't be scared if at one of the large houses, whether you're here or not as a large house, great, love you guys, you're good competitors, you can provide the services just as well as the large houses. Okay? Don't be afraid of it. Jump into it with both feet. Make sure you can take advantage of the opportunities that are before you to increase your revenue by as much as 27%. Okay, so let's talk a little bit about DOL audits. This is something I talk about a lot in my healthcare reform presentations to brokers, agents, producers across the country. If you work for a health plan, if you work for a third-party administrator, if you work for an ancillary company, this is critically important because, first of all, armed robbery, huh? Well, I'm in here for violating a Department of Labor audit. Okay? This is true stuff. You know, when I was talking to Richard last night at dinner, he was talking about how many employers are faced with fines and penalties that are equal to $100 a day, times the number of days out of compliance, times the number of employees that you have. Now, we're seeing a lot of employers being faced with six-figure settlements for fines and penalties. It's happening every single day. The fact is, healthcare reform, with the taxes that are born into the healthcare reform, and with the revenue that the government is looking for under healthcare reform, is not going to be enough to pay for the $1.2 trillion price tag of healthcare reform. So the government will be looking for other dollars. So what's happening? They're knocking on my clients' doors every single day. They're knocking on your clients' doors. So this is an actual example of one of my clients. The letter here is dated February 21st, 2012. It was received 6 days later, February 27th, 2012. It's a letter from the JFK building in Boston from a DOL auditor issuing a notice to this client. On this page, 19 different questions about what they have to respond to within 10 days. Within 10 days. Has anybody experienced this yet here? Just a couple? Okay, great. 3 people. So this is going to happen exponentially. They just hired 600 new auditors at the Department of Labor to do this specific service because they, like you were when you first started this business, they are dialing for dollars. So when I look at these types of things, I look at the top audit emissions. Some of the things that you can actually help them with. The first one that I have on here, a signed plan document, adoption agreement, trust agreement, wrap document, and a summary plan description. The fact is, this is so easy for you to provide. When I first started looking at Department of Labor audits and compliance for my clients, I actually contacted a law firm that does business with my company on a regular basis, and I said, you know, I need an SPD for a vision plan for this client that has 300 employees. Can you help me write this document because the vision care plan is not providing it, and nor does my client have the ability to do so. They provided that, but then at the same time they charged me, my company, $4,000. Okay? Now, I don't know what your rebating statutes are here in Tennessee, so what I share with you today, make sure you check to find out what you're able to do. The fact is, I have a lot more liberty in New Hampshire, but also, quite frankly, across the country, producers, agents, brokers have a lot more liberty to provide these types of investments to your clients. Because, well, if you think about it, when the rebating statutes first came out, they were essentially to avoid having any one of us give a cash incentive for someone to purchase insurance from you for some form or another. Now, our jobs, regardless of how many investments you made in your practices or your job or your company, our practices have transformed themselves no matter what, because many of you are already doing much more than what an agent or broker is supposed to do. Agents and brokers are essentially supposed to deal with the transaction of insurance. Well, when I first started in the business over 20 years ago, we did claims adjudication. And then it grew from there that we started getting to developing websites for our clients so the employees had access to their benefits on a 24/7 basis, and it's been kind of explosive from there. So essentially, if you're already doing services that are over and above the transaction of the sale of insurance, that's considered rebating if it's in your state. So what I always do is I treat all of my clients the same, no matter what. Every one of them gets an SPD, every one of them gets a wrap document, everyone has access to the exact same services, so I treat nobody differently. It's kind of like my own internal ERISA, treat all the same. And then we look at, these questions continue to go on. I'm up to 18. This section here on number 13 talks about a lot of those model notices that some of which came out under healthcare reform. I can see in there special enrollment rights, WICRA, newborns, Medicaid CHIP notices, the COBRA provisions, Michelle's Law, a certificate of credible coverage, another certificate of credible coverage. These are the things that you do every single day. Now, one of the things that I do in my business, and I'm actually going to get to this in a little bit for you, is all of my model notices every year at open enrollment. Every one of the employees, regardless if they're on the plan or not, receives the model notices from me. Every single one. So what we try to do for our clients is we want to make sure that we become their DOL audit team. We are their consultants. We are managing that process for them. So as the questions continue, This is a little overwhelming, isn't it? So for those other people, like those three gentlemen who said they've seen this before, the list just keeps going on and on.
That's all 2 years back, right? We went 2 years.
Sometimes longer. Sometimes longer. Because like when you deal with that issue about the special open enrollment rights, they're asking for any time you add a special open enrollment provision. So when the Michelle's Law, that's part of your healthcare reform, or the Michelle's Law that the state of Tennessee or any other state may have passed previously, they're looking for any opportunity for special open enrollment rights going back. They're also looking for how you're managing your recruitment. So if in the event you hire new employees, one of my top auto admissions, and by the way, I have a list of 10 top auto admissions, and I'll send them to all of you. One of our top auto admissions for the new clients that we take over, because a lot of how we sell business is we go through and we ask our prospects questions. Tell me, when you hire an employee, what do you give them? Can you show me the onboarding paperwork? Can you show me what you sent to them the first 2 weeks of their date of hire? So they talk about their I-9 forms, they talk about their application, they talk about collecting a driver's license and passport and other forms of identification. And so what do you have here as it relates to the Department of Labor, as it relates to health insurance plan? And top auto admission number one is that they forget to give them a COBRA notice within 14 days. Don't hand it to them, they have to mail it to them. And we make that very specific. Now, of course, tied in very nicely because of healthcare reform is the exchange notice, because you have to issue the exchange notice within 14 days of date of hire. So what do I do to combat that and help my clients to make sure they pass the test? We do it. Every single employee that they hire, we collect the data, we get them in the system, we send them the exchange notice, and we send them the COBRA notice. I know some of you are saying, oh my God, Tom, can you possibly do that for every single client? Yes, yes. You know, you have to also understand that New Hampshire is a totally different animal than Tennessee. I don't know where your compensation is at, so we've been at a reduced compensation for years. We've had what is you now know as modified community rating, I'd say ever since 2001 when the law passed back there. So when you have modified community rating, when you have reduced competition, you're also going to have reduced compensation, which has happened, I'm sure, here in the state of Tennessee with the rollout of healthcare reform. So I'm all about volume. With my business growing by 27%, much of that growth goes back into investments in staff and technology and resources to make sure that we can issue these notices to the employees within 14 days of date of hire. Why? Because when my client has a Department of Labor audit, these two binders was the response to that letter. My client called me that day that they received it on February 27, 2012, and they said, oh my goodness, Tom, what are we going to do? They're looking for all of this information. Remember some of those questions, WICRA, newborn children's, CHIPRA, summary plan descriptions, certificates of credible coverage. I said, I'll tell you what, give me the letter. I'm leaving for Marco Island tomorrow with my daughter, but I'll tell you what, by this time tomorrow, we'll have a full plan already engaged for your benefit, so you have nothing to worry about. So I called him back before the end of the day, and I said, tell you what, out of all those questions, there was something like 36 in total, although some of them were sub-questions. You take these two, and we'll take the remaining 34. And she said, seriously? And I said, we got it. Don't worry about it. So within 10 days of that date, we had these binders all prepared, shipped up to their office. They had to insert the other two sections that they already had. There's something about the bonding requirements that they had to do. And we did everything. So then, fast forward, 4 weeks later, the DOL auditor, his name is Kim Koski, and who actually has become friendly with me because he loves what I do, right? This was the second audit that he's been through with me from the JFK building. And he said, and the first thing he says on the phone, but I'm sorry, let me tell you, DOL called my client and said, we want to do a telephone interview with you on this date. Can you make it happen? The first call my client made was to me, and they said, Tom, we know nothing about what you put together here. Can you be on this telephone conference call? And I said, I'm absolutely happy to do so. And so we scheduled a day convenient for all of us. And when they got on the phone, the DOL auditor said to my client, they said, okay, we're here to talk about just some clarification questions of some of the submission. And they said, sure, but do you have any objection that Tom Harte is on the phone with you? He's our broker from Landmark Benefits, and he's assisted us with the Department of Labor audit. Oh yeah, great, I know Tom. By the way, I know Tom submitted this, and this is his work, and it looks really great. This is the best submission we've ever seen. Okay, well, chalk went up for Tom, number one, because my client is here, and the Department of Labor is telling my client it's the best submission that they've ever seen. Great. Now they're preserved as a client for life. For life, because they know these penalties of $100 a day times the number of days out of compliance, number of times the number of employees, would have been catastrophic to a client who has 286 employees on the plan, right? So they had asked some really like ridiculous questions for follow-up, because they have to ask something. They can't just say, oh, you have a clean slate. So all we had to do was respond back to a couple more questions of clarification, and it was done. No fines, no penalties. Pass with flying colors, no issues whatsoever. So I ask you, if you were to do something like this for your clients, wouldn't this be one of the most significant retention vehicles you can possibly ever have, right? So we actually took it to the next level. You can actually see one of my clients here. This client began a client for us August 2012, and we have one of the best relationships you could possibly ever imagine between a broker and a hospital client. 600-700 employees are on there. So our first promise to this particular hospital, because they have been through a number of management transitions over the past few years, was we have a checklist. The same checklist that I'm going to give to you that I promised you on slide number 2 is we have a checklist that we go through for you. You can actually see some of the tabs in there on the right-hand side. There's probably somewhere in the vicinity of 30 tabs that are on there. It goes through such things as, you know, the grandfathering aspects, all of the model notices, your summary plan description, plan document. Everything is in here that you want to be in here to pass the DOL audit. And we actually piggyback to some of the questions that are coming from the DOL today. And we also added a lot of the elements of healthcare reform to make sure that no matter what happens between now and whatever date that they might be subject to an audit, that we have every document in place at that moment in time. So should that audit come in on February 27, 2012, we're responding by February 28 because we already have everything in their office and in my office with a duplicate copy to make sure that we are prepared for just about anything. So of course, this client, having none of this information in force right now, and then within about a month or so, we have all of this set up for them. Again, new client looking at compliance, looking at my agency as being more of their consultant. Transformative relationship. Transformative. Never had experienced anything from this of their broker before, and that's one of the reasons why our retention is so high. We don't lose clients at my company, and of course compliance is just part of it, but this is huge. So I would suggest to you, if anything, embrace the opportunities before you today and get yourself engaged in compliance. You see here 5500s. Many of you have seen 5500s, whether you do anything with them or not, this is completely up to you. But what I do, for every one of our clients, by the end of the 7th month following the end of the plan year, we're filing plan year 5500s. We file 5500s for every one of those clients. So as they have 100 or more employees on the plan at the beginning of the plan year, then we're filing the 5500 and we're taking care of everything. We don't actually file the 5500. We hire a CPA company who charges me $250 for each filing, whether it's a wrap or not. I say wrap just so you understand this. Everything that we have in a summary plan description that goes into all of their plans, it covers the health, the dental, their life, their disability, any other benefits that are subject to the ERISA guidelines. We make sure that we file one 5500 for the entire wrap, or we file one 5500 for each of the plans, starting with plan number 501, going all the way down to whatever plan is left over. Is that your question, Richard?
You said you file, I just want to clarify.
Yeah. Well, see, here's the thing. It's
electronic.
somewhat transparent to my client because we collect the 5500 data, we give it to the CPA. The CPA does contact the client on our behalf because everything is done electronically with their PIN. So they're giving authorization to the CPA firm to file it. But everything looks, feels, tastes as though it's landmark benefits you're submitting on their behalf. The fact is there's some things that our clients do every single day. You know, when I first started my business in '97, the first value-added service that I integrated was COBRA. Now, a lot of brokers have always been like, well, my E&O doesn't really cover COBRA. Well, your E&O really doesn't come into play if you always do it right anyways, right? So COBRA is so easy because it's a formula you issue out. All you gotta do is put someone's name and address into your system, and everything gets done. And as long as you update your COBRA notice to now include the new exchange provisions, which was changed late last year, you're safe. Just make sure you keep updating your notices to make sure they're compliant with the Department of Labor, and the E&O never comes in. So this is easy. It costs me $250, and if a client brings in for my company, I don't know, $50,000, a $250 investment is nothing for the filing of a 5500. The fact is, if I were to ask people to raise their hands, how many of this audience do this today? Maybe one, maybe two might do that. The fact is, this is a very small investment to making sure you can retain your client for years to come. Plus, it also keeps you in control of the Department of Labor aspects of all of this. Now, it's really an ERISA issue, but you can always put it in your manual to make sure that you're showing them what's called a stewardship report to make sure that you're staying on top of what's required of them as an employer to make sure that the complicated laws that we're dealing with every single day. The next part of my compliance checklist that I give to all of my clients and builds my binder from, this is about a 13-page document. It has all the links and all the resources about what they have to make sure they're aware of. It explains the different documents. It gives the model notice integrated with it. So it's huge. So I did mention already the termination of coverage. This is an old form for us, but nonetheless it's on here for you just to say every time that an employer terminates an employee, they do not take their employees off the plan. They don't touch anything. All they do is they send us their termination form. Name, address, social security number, date of termination, date we terminate the plan. They sign it, they date it, they send it to us, and we take care of everything else. We take care of the COBRA. We collect the premiums. We make the payments on the premiums directly to the health insurance plan or the dental plan or whoever, whatever other plan they're taking for COBRA. Flex spending, HRA, we do everything. They never touch it ever again. Because again, a lot of employers see these former employees coming in making these payments directly to the employer, and they don't want them to come back into the workplace. So they come to landmark benefits and we completely remove them from it. So the more headaches we take away from our employer clients, the better out that we will be in the end.
And if you perform this for groups from 2 to infinity, and you don't.
Everyone. Everyone. Simple rule that I always do, I don't care how big of a client you are, how small of a client you are, we're going to provide the exact same service as long as you're subject to those provisions. Of course, like in your state as it is in mine, we have state continuation provisions and we have COBRA, so there may be some differences between the different documents that we issue depending upon your own state, but we take care of it all for everybody.
For no additional fees.
We don't charge any fee. I've never, ever, ever charged a fee to any one of my clients for any of the services that we do. Ever. I love to say that. There's some of the things, many times I will say those particular words. I also say I've never charged any additional commission over and above the standard compensation that's in our contracts. I just don't do it. We make ways to make money by high volume, high level service, retention. The fact is, and you guys all know this because whether it's a retail operation or wholesale or in the insurance business, one of the greatest expenses that we have is acquiring a new client. So if my retention of my business is 98, 99, 100% during the course of the year, I have so much that I have left on the table for my investments because of these retention tools, right? So the more I invest in retention, the more money I have left over for me and profitability to my company and being able to hire more employees and provide for additional growth.
You're too far from the weeds, but I'm just curious why you don't do the yourself.
I really see that as,
It's 5 minutes.
you're probably absolutely right, Jeff. I prefer when there's a tax form that's out there that I just leave it to a professional that, because it gives my clients greater confidence that it's not just an insurance broker doing it, it's a CPA, because historically they've had a CPA doing it, so I'm just going to let my CPA do it and just remove them from it. Think HR, one of the investments that we made last year, I love this tool. This has been a huge retention opportunity for us. Also, I know this has also helped us sell some business. So because we've become more of a consultant at my business over the past few years, a lot of the questions that we get are HR related. Personnel issues, discrimination, how do I deal with this vacation issue? How do I deal with this leave of absence? And some of these questions we can't answer. So I didn't like telling my clients that they're going to call somebody else or we would do some research online. So we invested in this organization called Think HR. It's a large investment for my company, but one client you get by using Think HR, it pays for itself like you can't believe. So what happens? Under Think HR, you can see here you have an HR hotline. The HR hotline is done this way. It's an 800 number that your clients call and they speak to an SPHR or PHR certified representative. Okay? Those are the professionals. They're senior level positions. They're not just generalists. They're directors and senior VPs of HR who are on this hotline. You ask them any question that you want on the phone, or send them an email and say, this is the question that I have, or post the question to the internet site that goes to the same set of professionals. And they respond back to you within 24 hours with a comprehensive response to your inquiry. In which turn, they're responding to me, usually, or one of my account managers, and then I take that answer and I send it back to my client saying, one of the members of our senior HR management team has responded back with this answer, this is what they're suggesting on how to handle this particular situation, and it's done. Okay? So most of our clients, if you have an employee that has 100 employees, they have one HR person. That one HR person is not enough to deal with all the personnel, management, HR issues on a daily basis. Simply, not one person can possibly know all the laws that good. It doesn't happen. So for them to know that they have another HR team to back them up for any questions is complicated, and that they're using my company for that is huge. Now, in addition to that, there's an HR library, and I know a lot of us have access to HR libraries all throughout the internet, but this is a system that is our true library of thousands of forms, documents, policies, procedures that our clients have access to every single day. Now, our clients, should they choose to, they can go directly to Think HR. I just prefer that they call us because it makes it look like landmark benefits, much like the 5500s, that they're coming to us first. We are the middle person. But the last part of it, which our clients love even more, I love the hotline, but our clients love the last part, which is HR training. Under HR training, there are hundreds, let me see this right here, there are hundreds of programs, environmental, wellness programs, safety, security, communications, customer service. Our HR professionals that are on our team for clients are looking for programs that they can offer to their employees on a regular basis that will allow them to become better and more productive and happier employees. And they're starving for this type of information. So every single day, our clients are going onto this library that we have here of all the training exercises, and they're downloading a video. And then they schedule an employee meeting to talk about sexual harassment in the workplace, and it's because of landmark benefits that they have this opportunity before that, and they don't have to do all the training on their own. It's huge. It's absolutely huge. Now again, I know this is a significant investment for some of you to consider something like this, but if you want to get into the larger marketplace, if you want to have your business grow by as much as 27% or more in 2014, these are the type of investments that you need to make. I love this one.
What's the HR cost?
It's somewhere around $15,000 for my client size. So if you have a smaller operation than I do,
They base it on the body count?
Yeah.
Practice?
yeah, they take my number. By the way, just like the question you asked earlier, sir, all of my clients, regardless of size, have access to Think HR, even if you're a two-person shop, which is what we do. So I add up all of the individual number of employees that we insure, look at the number of employers that we insure, and then they give us a number. Okay? So if you're a small shop, it's considerably less investment. BrainShark. Anybody heard of BrainShark? Oh, awesome. You all use it? Okay, so what we do for BrainShark at my company is, this one here happens to be for that same hospital client we talked about earlier. A lot of employees either miss the open enrollment session or they're hired after the open enrollment session. And the HR professionals who are on the team, there's 3 people on the team at this particular hospital, they can't possibly do the presentation like I did when we talked about the health plan, the dental, the life, the disability, the flexible spending, the HRA, all the other aspects of the plan. So we have this 30-minute video that's loaded up there that's mandatory for every new employee to sit through, and it's my voice walking through a slideshow that's live on a 24/7 basis, and then they're going to do their enrollments right through here. We actually also walk them through whatever paper applications are within the content of the package that they receive, which we have prepared for them. So an employee starts at Huggins Hospital, they go through the HR process, there's a folder that they receive, big old landmark benefits logo on it that says your employee benefit information, and don't open it until you see the video, and then all the forms are color-coded, just like we walk through in this particular presentation, and it makes life so much easier for the HR team. And you know how, this never happens to you, I'm sure, that employees submit applications to your agency and they're missing information, right? Never happens? Okay, well, the frequency of that happening with this particular tool is significantly less. And this is a small investment. Every one of our clients that we have on BrainShark, I think it costs my agency $9.99 a month. So if you have a client like Huggins Hospital who's paying my company maybe close to $100,000 a year, for me to invest $120 for BrainShark, that's nothing. You know, these are small investments to make a significant difference in your relationship with your clients. We also manage the entire open enrollment process. I know the role for a lot of brokers across the country is evidenced by the conversations that I've had, has been, well, let's show up and let's manage the process, maybe have the health plan do the presentation on the health plan, the dental company can do theirs. We do everything. I want to be the person who's talking to the employees because we are the consistent face every single year, and it makes us appear as though we're more part of the company. It just makes a huge difference. But also, we essentially say to our HR teams, you have nothing to do other than getting us a room and inviting the employees to be there. We take care of everything else, which includes the election forms, which we actually have for every one of our clients, what's called perpetual census. If we're enrolling and terminating all of the employees on a regular basis, we have their census already in our system every single day, 24/7. So when we create these election forms, we have their name, their address, their current elections, we have everything. So it takes us a matter of minutes to create, for a company like Huggins Hospital, 600 election forms. It's done in a few minutes, it's all done. But it'll take them weeks to get it done because they don't have the same system capabilities that we have. How am I doing so far? Is this good? Just that side of the room, not this side?
But I'm wondering, you said the online enrollment system.
Yes, we did.
That's what I.
Yeah, I'm going to talk to you about that in 1 minute, I
I'm
promise.
also curious about a database. You must obviously link this all together into a single database.
Yes, we did.
What word do you use?
For this particular one, we're actually using an ACT database system.
Okay.
But her question is, what are we using for online? We're transitioning away from our ACT database over to another system. And this is a little teaser for 2 slides away. But the ACT database has been perfect for us because this is an ACT document and it simply drops the person's name in there. The ACT database controls how they're enrolled today. So Huggins Hospital has their own ACT database in my system. And when we update elections, when we update adding or terminating an employee, we update the ACT database. So when payroll election forms come out, we just say print payroll election form and it's done. It's that easy. It's truly just moments away. We do, like most of you do, a lot of communications that relates to the employees. We actually love this particular piece, not because it's so simple, but because it really answers 95% of the questions that the employees may ask. And as I always say to every group that we talk to, if in the event that this document doesn't answer the questions that you have, we have the phone numbers in the back to go directly to the carriers or directly to my company. And we're steering that away from human resources, because one of the greatest complaints that we always have is employees are knocking on our door every single day asking about benefit questions that we really can't answer. So we want to make sure we steer that away from human resources so they can focus truly on human capital management as opposed to employee benefit management. These discs, a small investment. Make sure you write this one down, because if I talk about anything today that's a small investment, the discs are so easy. Because when you go in and do your open enrollment sessions, you're bringing in your two-wheel dolly of all these documents, and you make 2 or 3 trips to your car. For a large employer, if you're a small employer, you have a big box, letter-sized box carrying in all the documents and papers and forms and brochures and everything. We don't. We do not. All we bring in when we go to our open enrollment sessions is an envelope for each and every one of the employees and their election form and a disc. That's it. So we make 1 trip to the car for a group that has 600 lives, and if it were you, you're making multiple trips back and forth to your car because you're doing the old-fashioned way. This disc has everything on it. So we logo it, and on the back of the sleeve itself, we say, this is what you're going to find inside this disc. All of your benefit summaries, your health, your dental, your life, your disability, your discounts, your member savings programs, your summary plan description, all of the model notices. Remember we talked about that? All of the model notices are on this disc. Your life and disability benefits, all the forms you need during the course of the year for enrollments, changes, and terminations, everything that you need to manage your own benefits, all of the benefit summaries that we distribute to you are all on this disc. So you're probably saying, Tom, how do you possibly get all those discs done for a 600-person company? Well, we have this system, which is really cool. It's very inexpensive. I think it cost me $600. It's a 6 CD burn. I stick 1 CD in the top tray, and my staff member will burn 6 CDs at a time. It takes about 30 seconds, so we get them done before you know it. And then they attach the labels to it. Right now, we're actually going away from labels, and we're having all of our discs pre-printed with Landmark Benefits logo on it, and they're all customized discs, and they're really cool. But the fact is, our clients love this because their trash is filled with documents on the day of open enrollment. So you waste a lot of paper, I've wasted a lot of paper. The best way to do it is use this disc, and it's so cheap, so cheap.
We use web-based employee benefit centers.
Yep.
Where we just post everything out on that center.
Yep.
Instead of using this.
Yeah, same trick. A lot of brokers don't have that ability today, but also a lot of clients don't want to have that extranet or intranet where they're posting it. So this is the next best part of it. Margaret has asked here about our online capabilities. We're doing the same thing, where we're posting it to it's an extranet, I would call it, because it's not posted by the company, it's somewhere else different. So it's really one or the other. So this is the easy way to do it. Our open enrollment posters, you're saying, Tom, big deal, you do open enrollment posters. Well, some of you may, anybody here doing open enrollment posters? Well, how do you make them better? I always say to myself, for those 3 or 4 of you raise your hand, I always say to myself, how do I make this better than my competition? Because most of you might be saying, well, I have the ability with my Canon copier in my office to print an 11 by 17 open enrollment poster. And you may be doing that, don't raise your hand, so I don't want you to be guilty of this. But here's what I did, because I always say to myself, how can I make it better than my competition? So I bought a printer. Okay, big deal, Tom, you bought a printer. I bought an architectural printer. Okay? My architectural printer can print my open enrollment posters as large as I want them to be, but every one of them is printed in a 2-foot by 3-foot format and mounted on foam core. And they are awesome. Because no employee can possibly miss it when I have a 2-foot by 3-foot poster that's posted, not on the wall, by the way. We give every one of our clients easels because they stand out a little bit more. Okay, easel costs you $39, but you get 4 of them for a client like the size of Huggins Hospital. It's well worth the investment. And to print it, the printer that we bought was $1,200. But again, huge differentiation from your competition. Also imagine, if you will, that you go into a prospect and you bring your props with you, and in those props you bring in these huge posters, and they're all colorful and they're beautiful and they're very professional, and no other broker is coming in with these huge 2x3 architectural printings. And again, huge differentiation. It's a great prop to bring with you. As much as a prop as the discs when you bring them in there to show people, the HR professionals that you're talking to, the senior executive, how you're differentiating yourself in your own practice, and it just makes such a huge impact in that conversation. Okay, so a couple of logos that I want to introduce you to. On the left-hand side is our new Employee Navigator. So on the Employee Navigator, so historically we've been using the app database, which we can convert over to an Excel spreadsheet, all the data that we have in our system. So like Jeff said, what we can do with the app database is we take all the information that's in there and we convert it over to an Excel document, and then we upload it to the Employee Navigator. So on the Employee Navigator, which we're just launching right now, which by the way is all done either on an iPhone or on the intranet. Now the reason why I choose Employee Navigator is because I'm always looking for value. Okay, there's a lot of services that are out there. We chose the Employee Navigator because the expense is significantly less than everybody else who's out there. Significantly less, and have all the tools and resources that we needed to make sure that we could differentiate ourselves in the marketplace. So we upload all the information, the employee goes in at open enrollment, and they make any change that they want to have, and we track it every single day. When the employee makes a change during the course of the year, during some, maybe they have an open enrollment provision, a qualifying event they have access to, well, that information gets sent to my office to drop the dependent, to add a dependent, to make some kind of a change, and we make the change. The information comes to us, and we circle back with the employer, just let them know, just to confirm, Sally Jones sent us a request to take her dependent off the plan, we've taken them off the plan, and everything is all set, and it's all tracked in the Employee Navigator. So then at open enrollment now, like the gentleman in the back said, sorry, I don't know your name, he said, well, we have this extranet where all the forms and policies and everything we're distributing on the disks, everything can also be on the Employee Navigator. It makes a huge impact, especially the fact that we have access to the iPhone app. Now, a lot of people are really going to use the iPhone app to look at their benefits on a regular basis. Probably not. But a lot of what we've done historically in the employee benefit business is differentiate ourselves by having these resources available. So maybe if 5% of the population of the employees that you're serving every single day are using the iPhone app, great. They will love it. We're making a difference for them. They're telling the HR professionals, I love the iPhone app, and that's something that you're delivering. And it's a very low expense to do that. I talked about Think HR. We are a Xyway partner. It used to be that a client would send me an email and ask me, well, Tom, what kind of information do you have on the pay or play provisions for temporary staffing firms? Well, I have to go out and do the research for it. Well, Tom, how do we handle the pay or play calculations for an educational facility? We insure several colleges. Well, I have to go out and do the research for that. So now, those two specific examples, which I was looking at the other day on Xyway, I don't have to go through hours of research to find out how it works. I go to Xyway, I download the document, and I send the document off to my client. It's all branded to my name. That's a significant investment, but I've always looked at it this way. If I was doing all the research before on my own and spending countless hours developing the communication tools for my clients, then what is my time worth? My time is worth a lot. So I'd much rather purchase a Xyway product, which costs my company a significant amount of money, because it's actually buying me more time to do what I should be paid for, which is retaining my clients, visiting with them, selling new business, and making a difference in the lives of my employees. Strategic coach, I am a strategic coach partner. Sometimes as an entrepreneur, you kind of lose your way, even though some people will say, Tom, your line is pretty good, you've done a good job for the company. I'm always striving for more. Like when I ask myself that question about the posters, how can I do it better? The same thing holds true of strategic coach. Strategic coach allows me to remove myself from the office on a quarterly basis and allow them to look at me and allow me to look at myself and my company and say, how can I make our operation better? How can I differentiate? How can I deal with some of the challenges that I have in my company to make sure in the end that we're thriving as we have and continue to thrive going forward? So strategic coach has been great for me. Strategic recovery partnership, write that one down, because earlier in my presentation I talked about the summary plan descriptions. We are a strategic recovery partnership partner, and they write our SPDs for us for the software that we have in our office. Okay, I have one staff member dedicated to making sure that all of our clients have an SPD, and they all do today. Every one of them, regardless of size. Because some people may say that even under healthcare reform, it says that even a two-person shop should have a summary plan description. Some of you may argue with me about that, but I'm just playing it safe. You might as well have it. It's so easy. It's like an app database-driven module that you're actually putting in the employer name and all the provisions of their plan. And it costs me, I think, $450 a month to make sure that every single month all of my clients are updated with their SPDs. That's nothing. So it costs me $5,000 a year, maybe $6,000 a year to have access to the software. Dragon, because I'm here in Nashville, Tennessee, I don't always have the opportunity to respond to all my emails in a timely manner. It's all about productivity for me. So Dragon is cheap. You can write 3 to 4 times as many emails as you possibly can typing. I type fast, but I speak faster, as you can see, right? I don't too fast. You guys liking this? Okay. Cheer anytime you want. Okay, MyEdge. Anybody heard of MyEdge? 2, 3, good. Okay, MyEdge, another great tool. If you're looking to get into the large group marketplace, or if you're in the large group marketplace and you're looking for opportunities, most people I know, Jeff talked to me last night about Judy Diamond and Associates. That's the more antiquated access to the 5500 information. MyEdge, a company actually based out of Bedford, New Hampshire, about 10 miles from my home, a national presence. They have all of the data for all of the 5500 filings, and you can search it so easily. So in the event that there's a broker that you know that is not providing a specific service, maybe they're not doing the discs or the employee navigator, they don't do COBRA, they don't do DOL audits, they don't do, if you know who that is and that's your wedge, if you will, for your sales, well, you go into MyEdge and you search for that broker for all of their clients, and you can say, okay, well, ABC broker, who's not a member of NAHU, by the way, go after them because they're not a member, Jeff, okay? They're not a member, ABC broker, well, I'm going to go after all these clients who are listed because these are the 5500 information. If you have a good relationship with a CPA, you can search by their CPA. If you want to search simply by who are the largest companies in the state of Tennessee, if you're in Kentucky, wherever you want to go, whichever module you want to purchase, I use this all the time. All the time. It's so easy for me to, like we do a lot of colleges, so we're looking at colleges all the time on the MyEdge throughout all of New England to make sure that we are like the leading expert in New England on colleges and hospitals. So they come to us. So they already know about me, so I need to know how much money I'm going to make before I even walk in the door. Okay, WellCOA, it's always good to have a stamp of approval. For me, WellCOA, the Wellness Council of America, I've been saying this for years, and I know Jeff was talking to me about it last night, that I've always said that health insurance is expensive because health care is expensive, not the other way around. So what we try to do is recognize that 70% of the cost of health care comes from preventable health care conditions. So we have been for years, the past 20 years, rolling out wellness programs, and we have a staff of wellness professionals on our team who are going out on a regular basis to improve the health and the wellness of the employees that we serve. It's a huge differentiator because those clients of ours who have been in these wellness programs for as many years as we've started them, they really have not had a rate increase in years. We have one client right now, 6 years straight, no rate increase. 6 years. Okay? Predominantly because of their engagement with the wellness programs. And of course, well, NAHU's logo is on there every slide anyways, but there is a good reason why NAHU is on there anyways. So, compliance checklist items, just a few of them. I'm going to go with time here. Am I good? I'm already over? Okay, you guys are so engaged. I'm going to keep going. So some of the things are on my compliance checklist, summary plan description, the chip notices, newborn mothers. We do all of this for them. Make sure you understand what the deadlines are because those are critically important. Employer shared responsibility. I put this up there because a lot of brokers across the country are not really sure about what was delayed and what is delayed. And this may be a little late notice. I know this was released on July 2nd of 2013, but there's still a lot of confusion about it. So what was not delayed? First, the individual mandate, you all know that. The establishment of the exchanges in the marketplace and the notices that were also required. The rating restrictions, which I know is somewhat devastating in the state of Tennessee, and I apologize for that. I can assure you that NAHU has been advocating for changing how they come up with these rating restrictions for small businesses, and it is devastating to small businesses in the state of Tennessee, and I wish we could change it. The only way you can make a difference, by the way, and I know Richard was talking about it earlier, is attending the Capital Conference. That's a small investment also, by the way, but I'll tell you, I know a lot of people attend the Capital Conference because the association pays for it, but I'll also tell you that when you're looking to add items to your resume, that attending a legislative conference, when you tell your clients, I made an investment, I spent $500 to attend the annual legislative conference for NAHU, and I met with your senators, and I met with your members of Congress, and this is what I told them. I told them that you're struggling through healthcare reform, the health insurance prices have increased 100%. I used you as a specific example in my conversations, and I just wanted to tell you I'm trying my best to make a difference with the outcome of healthcare reform. So, regardless of who pays for it, if you can make a small investment to make sure that you can put that on your resume, it makes a huge difference. The fact is, as president of NAHU, I certainly get a lot of exposure. I don't ask for it, it just comes with the job. But my clients call me almost every day because they're seeing my name in the New York Times and Fox Business and the Wall Street Journal and newspapers and publications across the country. I don't send out news blasts to say, hey, just so you know, what's in the New York Times today? I never do it. But they call me because my clients are educated. They're reading these periodicals. They're seeing that their broker is on the front page of these periodicals, and it makes a difference. Okay? So make sure you consider the opportunity to go to the Capital Conference and make it your own investment if you're not on there anyways.
I have one more thing about that conference.
Yeah.
It's fun.
Yeah.
You know, it's fun. It's really worth going. It's a good time. Our senators, our two senators actually have, which I learned early on, I can read here, they actually have Tuesday morning every week session where they open doors and let everybody you have free access to them, to their staff. So it's a fun event to go to.
You know, I made a note here earlier, but I think it was, I don't know if it was Richard